Today we will read about the reproductive health. In this section, reproductive health, problems and strategies, population explosion and birth control, medical termination of pregnancy, sexually transmitted diseases and infertility. You have learned about the human reproductive system and its function in chapter 3. Now let's discuss a closely related topic, reproductive health. What do we understand by this term? The term refers to the healthy reproductive organ with the normal functions. However, it has a broader perspective and includes the emotional and the social aspects of the reproduction also. According to the WHO organization, reproductive health means a total well-being in all aspects of reproduction, that is physical, emotional, behavioral and the social. Therefore, a society with the people having the physically and the functionally normal reproductive organs and the normal emotional and the behavioral interaction among them in all sex related aspects might be called as reproductive healthy. Why it is significant to maintain a reproductive health and what are the methods taken up to achieve it? Let us examine them. Reproductive health problems and strategies. India was amongst the first countries in the world to initiate the action plans and the programs at a national level to attain the total reproductive health as a social goal. These programs, called the family planning, were initiated in 1951 and were periodically assessed over the past decades. Improved programs covering wider reproduction related areas are currently in the operation under the popular name Reproductive and the Child Health Care (RCH) programs. Creating awareness among the people about the various reproduction related aspects and providing facility and support for building up a reproductively healthy society are the major tasks under these programs. With the help of audio, visual and the print media, governmental and the non-governmental agencies have taken various steps to create awareness among the people about reproduction related aspects. Parents, other close relatives, teachers and the friend also have a major role in the dissemination of the above information. Introduction of sex education in the schools should also be encouraged to provide the right information to the young so as to discourage the children from believing in the myth and having the misconception about the sex related aspect. Provide proper information about reproductive organs, adolescence and the related changes, safe and the hygiene sexual practices, sexually transmitted disease, STD and the AIDS, etc. would help the people, especially those in the adolescent age group, to lead a reproductively healthy life. Educating people, especially fertile couples and those in the marriageable age group, about available birth control options, care of pregnant mothers, postnatal care of the mother and the child, importance of the breastfeeding, equal opportunity for the male and the female child, etc. would address the importance of bringing up the socially conscious healthy families of desired size. Awareness of problems due to uncontrolled population growth, social evils like sex abuse and the sex related crimes, etc. need to be created to enable people to think and take up necessary steps to prevent them and thereby build up a socially responsible healthy society. Successful implementation of the various action plans to attain the reproductive health requires strong infrastructural facilities, professional expertise, and the material support. These are essential to provide medical assistance and the care to the people in reproductive related problems like the pregnancy, delivery, STDs, and the abortion, contraception, menstrual problem, infertility, etc. Implementation of the better technique and the new strategies from time to time are also required to provide more efficient care and assistance to the people. Statutory ban on the amniocentesis for the sex determination to legally check increasing of menace of the female feticides. Massive child immunization, etc. are some programs that merit mention in this connection. In amniocentesis, some of the amniotic fluid of the developing fetus is taken to analyze the fetal cell and dissolve the substances. This process is used to test for the presence of certain genetic disorders such as Down syndrome, hemophilia, sickle cell anemia, etc. determine the survivability of the fetus. Research on the various reproduction related areas are encouraged and supported by the governmental and the non-governmental agencies to find out the new method or to improve upon the existing ones. Do you know that Saheli, a new oral contraceptive for the female, was developed by the scientist at the Central Drug Research Institute (CDRI) in the Lucknow, India. Better awareness about the sex related matters increased number of medically assisted deliveries, and the better postnatal care, leading to the decreased maternal and the infant mortality rates. Increased number of couples with the small families, better detection and the cure of STDs, and overall increased medical facilities for all the sex related problems, etc., all indicate improved reproductive health of the society. Population stabilization and the birth control. In the last century, in an all-around development in the various fields significantly improved the quality of life of the people. However, increased health facility along with the better living condition had an explosive impact on the growth of the population. The world population was around 2 billion, that is 2000 million in 1900, to about 6 billion by 2000 and by 7.2 billion in 2011. A similar trend was observed in India too. Our population, which was approximately 350 million at the time of our independence, reached close to the billion mark by 2000 and crossed 1.2 billion in May 2011. A rapid decline in the death rate, maternal mortality rate (MMR), and the infant mortality rate (IMR), as well as an increase in the number of people in reproducible age, are probably reason for this. Through our reproductive child health program (RCH program), though we could bring down the population growth rate, it was only marginal. According to the 2011 census report, a population growth rate was less than 2%, that is 22,000 per year, a rate at which our population could increase rapidly. Such an alarming growth rate could lead to an absolute scarcity of even the basic requirement, that is food, shelter and the clothing, in spite of significant progress made in those areas. Therefore, the government was forced to take up the serious measure to check this the population growth rate. The most important step to overcome this problem is to motivate smaller families by using various contraceptive methods. You might have seen advertisement in the media as well as poster bills, etc., showing a happy couple with the two children with a slogan "Hum do, hamare do, we two and our two." Many couples, mostly the young urban working ones, have even adopted and one child now. Statutory raising of the marriageable age of the female to 18 years and that to the males 21 years are incentive given to the couples with the small families are two other measures taken to tackle this problem. Let us describe some of the commonly used contraceptive methods which help prevent unwanted pregnancy. An ideal contraceptive should be user-friendly, easily available, effective, reversible with the no or the least side effect. It also should in no way interfere with the sexual desire or the sexual act of a user. A wide range of contraceptive methods are presently available which could be broadly grouped into the following categories, namely natural, traditional, barrier, IUDs, other oral contraceptives, injectables, implants and the surgical methods. Now, natural method. Natural method work on the principle of avoiding chances of ovum and the sperm meeting. Periodic abstinence. Periodic abstinence is one such method in which the couples avoid or abstain from the coitus from the days 10 to 17 of the menstrual cycle when ovulation could be expected. As chances of fertilization are very high during this period, it is called the fertile period, and therefore by the abstaining from the coitus during this period, conception could be prevented. Withdrawal or the coitus interruptus is the another method in which the male partner withdraws his penis from the vagina just before ejaculation so as to avoid the insemination. Lactational amenorrhea, absence of the menstruation method, is based on the fact that ovulation and therefore the cycle do not occur during the period of intense lactation following parturition. Therefore, as long as mother breast feeds the child fully, chances of conception are almost nil. However, this method has been reported to be effective only up to a maximum period of the 6 months following parturition. As no medicines or devices are used in this method, side effects are almost nil. Chances of failure thou of this method are also high. In barrier methods, ovum and sperms are prevented from physically meeting with the help of barriers. Such methods are available for the both males and the females. Condoms are the barriers method made up of thin rubber latex sheath that are used to cover the penis in the male or the vagina and the cervix in the female just before the coitus so that the ejaculated semen would not enter into the female reproductive tract. This can prevent conception. Nirod is a popular brand of condom for the male. Use of condoms has increased in recent years due to the additional benefit of the protecting the user from contracting STIs and AIDS. Both the male and the female condoms are disposable, can be self-inserted and thereby keeps privacy to the user. Diaphragms, cervical caps, and the vaults are also barrier made up of rubber that are inserted into the female reproductive tract, cover the cervix during the coitus. They prevent conception by blocking the entry of sperms through the cervix. They are reusable. Spermicidal creams, jellies, and the foams are usually used along with this barrier to increase their contraceptive efficiency. Another effective and the popular method is the use of intrauterine devices. These devices are inserted by doctor or expert nurses in the uterus through the vagina. These intrauterine devices are presently available as the non-medicated iodides, example lips loops, copper releasing iodides, copper T, copper 7, multilode 375, and the hormone releasing iodides are progesterazole LNG20. Iodides increase phagocytosis of the sperm within the uterus, and the copper ions releases suppresses sperm motility and the fertilizing capacity of the sperms. The hormone releasing iodides in the addition. The hormone releasing iodides in addition make the uterus unsuitable for the implantation and the cervix hostile to the sperms. IODs are the ideal contraceptive for the females who want to delay pregnancy or the space children. It is one of the most widely accepted method of the contraception in India. Oral administration of small doses of either progestogens or the progestogen-estrogen combination is another contraceptive method used by the females. They are used in the form of tablets and hence are popularly called as pills. Pills have to be taken daily for a period of 21 days, starting preferably within the 5 days of menstrual cycle. After a gap of 7 days during which the menstruation occurs, it has to be repeated in the same pattern till the female desire to prevent conception. They inhibit ovulation and implantation as well as alter the quality of cervical mucus to retard the entry of sperms. Pills are very effective with the lesser side effects and are well accepted by the females. Saheli, the new oral contraceptive for the females, contain a non-steroidal preparation. It is a once a big pill with a very few side effects and hence of high contraceptive value. Progestogens alone or in combination with the estrogen can also be used by the females as injection or implants under the skin. Their mode of action is similar to the oral pills to that of the pills and their effective periods are much longer. Administration of progestogens or progestogen-estrogen combination or the IUDs within 72 hours of coitus have been found to be very effective as emergency contraceptive as they could be used to avoid possible pregnancy due to rape or the casual and unprotected intercourse. Surgical method, also called sterilization, are generally advised for the male and the female partner as the terminal method to prevent any more. Vas deferens and the fallopian tube cut. Pregnancy. Surgical intervention blocks the gamete and thereby prevent conception. A sterilization procedure in the male is called vasectomy and in the female tubectomy. In vasectomy, a small part of the vas deferens is removed or tied up through a small incision or the scrotum, whereas in the tubectomy, a small part of fallopian tube is removed or tied up through a small incision in the abdomen or through vagina. These techniques are highly effective, but their reversibility is very poor. It needs to be emphasized that selection of a suitable contraception method and its use should always be taken under in the consultation with the qualified medical professionals. One must also remember that contraceptives are not regular requirement for the maintenance of the reproductive health. In fact, they are practiced against a natural reproductive event, that is conception and pregnancy. One is forced to use this method either to prevent pregnancy or to delay space pregnancy due to the personal reasons. No doubt, the widespread use of this method have a significant role in checking uncontrolled growth of population. However, there are possible ill effects like nausea, abdominal pain, breakthrough bleeding, irregular menstrual bleeding, or even breast cancer, though not very significant, should not be totally ignored. Now, MTP, medical termination of pregnancy. Intentional or voluntary termination of pregnancy before the full term is called medical termination of pregnancy or MTP or induced abortion. Nearly 45 to 50 million MTPs are performed in a year all over the world, which account to the 1/5 of the total number of conceived pregnancy in a year. Whether to accept or legalize MTP or not is being debated upon in many countries due to emotional, ethical, religious or social issues involved in it. Government of India legalized MTP in 1971 with some strict conditions to avoid its misuse. Such restrictions are all the more important to check the indiscriminate and the illegal female feticide which are reported to be high in India. Why MTP Obviously, the answer is to get rid of the unwanted pregnancy either due to the casual unprotected intercourse or the failure of contraceptive use during the coitus or rapes. MTPs are also essential in the certain cases where the continuation of the pregnancy could be harmful or even fatal either to the mother or to the fetus or to the both. MTPs are considered relatively safe during the first trimester, that is up to the 12th week of pregnancy. Second trimester abortion are much more riskier. One disturbing trend observed is that a majority of the MTPs are performed illegally by the unqualified quacks, which are not only unsafe but it could be fatal too. Another dangerous trend is the misuse of the amniocentesis to determine the sex of the unborn child. Frequently, if the fetus is found to be female, it is followed by the MTP. This is totally against what is legal. Such patients should be avoided because these are dangerous both for the young mother and the fetus. Effective counseling on the need to avoid unprotected coitus and the risk factors involved in the illegal abortion, as well as providing more health care facilities, could reverse mentioned unhealthy trend. STIs, sexually transmitted infections. Infections or disease which are transmitted through the sexual intercourse are collectively called the sexually transmitted infection STI, or venereal diseases VD, or the reproductive tract infections RTI. Gonorrhea, syphilis, genital herpes, chlamydiasis, genital warts, trichomoniasis, hepatitis B, and of course the most discussed infection in the recent years, HIV leading to the AIDS, are some of the common STIs. Among these, HIV infection is the most dangerous and is discussed in the chapter 8. Some of these infections like hepatitis B, HIV can also be transmitted by the sharing injection needles, surgical instrument, etc. with the infected persons. Transfusion of blood or from an infected mother to the fetus too. Except for hepatitis B, genital herpes and HIV infections, other diseases are completely curable if detected early and treated properly. Early symptoms of the most of these are the minor, including itching, fluid discharge, slight pain, swelling, etc. in the genital region. Infected females may often be asymptomatic and hence may remain undetected for long. Absence or the less significant symptom in the early stages of the infection are the social stigma. Absence or the less significant symptoms in the early stages of the infection and the social stigma attached to the STIs deter the infected person from going for timely detection and proper treatment. This could lead to a complication later, which include pelvic inflammatory diseases, PID, abortions, stillbirth, ectopic pregnancies, infertility, or even the cancer of the reproductive tract. STIs are the major threat in a healthy society. Therefore, prevention or the early detection and the cure of these diseases are given prime consideration under the reproductive health care programs. Though all the persons are vulnerable to these infections, their incidences are reported to be very high among the person in the age group of 15 to 24 age. The age group to which you also belong. There is no reason to panic because prevention is possible. One could free of this infection by following simple principle given below. Avoid sex with the unknown partners, multiple partners. Always try to use condom during coitus. In the case of doubt, one should go to qualified doctor for the early detection and get complete treatment if diagnosed with the infection. Infertility. A discussion on the reproductive health is incomplete without a mention of infertility. A large number of couples all over the world, including India, are infertile. That is, they are unable to produce children in spite of unprotected sex. Sexual cohabitation. The reason for this could be many: physical, congenital diseases, drugs, immunological, or even psychological. In India, often the female is blamed for the couple being childless, but more often than not, the problem lies in the male partner. Specialized healthcare units, infertility clinics could help in diagnosis and corrective treatment of some of these disorders and enable these couples to have a children. However, when such corrections are possible, the couples could be assisted to have children through the certain special techniques commonly known as assisted reproductive techniques, that is ART. In vitro fertilization. IVF fertilization outside the body is in almost similar condition as that in the body, followed by the embryo transfer is one of such methods. In this method, popularly known as test tube baby program, ova from the wife or the donor female and the sperms from the husband or the donor male are collected and are induced to form zygote under the stimulated condition in the laboratory. The zygote or the early embryos with the up to 8 blastomeres could then be transferred into the fallopian tube, that is zygote intrafallopian transfer GIFT. After and embryos with the more than 8 blastomeres into the uterus IUT, intrauterine transfer, to complete its further development. Embryo formed by in vivo fertilization, fusion of gamete within the female also could be used for such transfer to assist those females who cannot conceive. Transfer of an ovum collected from the donor into the fallopian tube, that is GIFT, gamete intrafallopian transfer, of another female who can not produce one but can provide suitable environment for fertilization, and the further development is another method attempted. Intracytoplasmic sperm injection ICSI is another specialized procedure to form an embryo in the laboratory in which a sperm is directly injected into the ovum. Infertility cases, either due to the inability of the male partner to inseminate the female or due to the very low sperm counts in the ejaculates, could be corrected by artificial insemination, that is AI technique. In this technique, the semen collected either from the husband or a healthy donor is artificially introduced into the vagina or the uterus, intrauterine insemination of the female. The options are many. All these techniques require extremely high precision handling by specialized professionals and expensive instrumentation. Therefore, these facilities are presently available only in a very few centers in the country. Obviously, their benefits is affordable to the only a limited number of people. Emotional, religious, and the social factors are also deterrents in the adoption of this method. Since the ultimate aim of this procedure is to have a children, in India we have so many orphan and destitute children who would probably not survive till maturity unless taken care of. Our laws permit legal adoption, and it is as yet one of the best method for the couple looking for the parenthood. Okay, this is completed. Now summary. Reproductive health refers to a total well-being in all aspects of the reproduction, that is physical, emotional, behavioral, and the social. Our nation was the first nation in the world to initiate various action plans